Welcome to the Reprofiles, where infertility meets injustice and nothing is off limits.
We're two nurses. We're certified reproductive health advocates, and we're here to tell you everything they didn't.
From the broken systems to the heartbreak left behind, we're here to connect the facts, the policies, and the pain.
Because silence isn't safety, and we're done being quiet.
This is the Reprofiles.
Infertility, injustice, and all things nobody warned you about.
Well, we are back. Welcome to the Reprofiles. Episode 1 was kind of a big deal.
Yeah, Raging Success doesn't even cover it. Thank you to everyone who listened, DM'd us, and tagged us in your posts.
We really appreciate it. We also appreciate you all who shared your own stories. We feel every word of them. We're reading them, and we want you to know that it matters to us, your story. We'll give you information later in the show on how you can continue to send those stories our way.
But today, buckle up. First up, I'm going to talk about some broken promises, and then we're going to dig into the BBB, which if you don't know what that is, you will soon. But first, let's acknowledge what today is the 105th anniversary of the ratification of the 19th Amendment. And for you people that forgot what that is because you forgot your high school civics class, that is the amendment that gave women the right to vote in 1920. So I'm trying to recreate my 90s vibe and my style today. But trying to find a 100-year-old fashion in my closet is like not very easy. So I'm doing the best I can today, okay?
You look great. I feel underdressed, to be honest. So those of you who are only listening to us on Spotify and Apple Podcasts, you may want to hop over to our YouTube of this episode because you do not want to miss how perfectly on point our AnnMarie in her 20s getup is.
Elizabeth, where were you on June 3rd, 2024?
Ooh, I know that one. I was sitting right next to you in the Senate
Yeah?
gallery watching. Yeah, we remember watching the vote for the right to IVF bill and ultimately watching it fail.
And then just a few months later, on September 17th, 2024, the Senate voted again on Senator Duckworth's IVF bill, and again, Republicans voted against it. Well, except for Senators Collins and Murkowski.
I mean, at the end of the day, does that surprise anyone? No, it does not. But after that second vote is when the spin really started, right? Like we saw, folks saying it was just a show vote and Democrats were misrepresenting their position on IVF, which really is hilarious because all it showed was exactly who thinks IVF is worth protecting and who doesn't at the end of the day. And remember, we sat and we talked about this a little bit in the last episode, but we sat looking down upon a bunch of white dudes congregating in the corner. And like you said, it was very clear who thought it was worth protecting and who didn't.
Well, hey, do you remember this part? I don't know if you remember this part. A senator walks in and he just walks in and his vote is a thumbs down.
That's right. I do remember that. So dramatic, so performative, but also very illustrative of the Congress in general.
Yeah. Anyway, then August 29th, 2024, Trump says he'll support government or insurance covering IVF.
Yeah, no
That's
kidding.
exciting.
And then,
everybody got excited.
Yeah, 2 weeks later then at that debate in DC, he calls himself a leader on fertilization and IVF, right? Like, remember?
Yeah, but it's even better. My favorite one is on October 15th at a Georgia town hall. He calls himself the father of IVF, which is fascinating because IVF research started in like the 50s, went through the 60s and 70s, and apparently it happened all under his leadership, even when he was like a toddler, a kid.
I mean, not surprising. I mean, he's a prodigy or time traveler, probably both. Probably the best time traveler you've ever seen.
Yeah, absolutely.
Indeed.
And let's not forget that he did say that it took him about 2 minutes to understand IVF when someone explained it to him.
2 minutes? Are you kidding me? Oh, it took me months and months and months of training, if not years, but sure, we're probably just slow, right?
Yeah, we should really work on that. February 18th, 2025. There's an executive order for IVF policy recommendations. It expires on May 19th, the day before Federal Advocacy Day. By the way, how was my Advocacy Day? Thanks for asking. It was not great. My
I
Florida
remember.
reps for the office staff that I met, very dismissive. They were polite. Don't get me wrong. They were just very dismissive, except for one actual representative who I shall refrain from naming, but he was in a hurry and only wanted to speak with one of his constituents. And the rest of us were invisible as far as he was concerned. Oh, sorry, as they were concerned. The one highlight meeting that day was with Representative Wasserman Schultz. I'm not in her district, but it was such a breath of fresh air to have somebody supporting.
No, it is too, and I would agree with you. I mean, at the end of the day, just having a conversation with someone that could have that conversation in a real way, constituent or not, it's always a breath of fresh air, I think, speaking to folks who aren't brainwashed. But I think it's important for us to look at what's happened since then, right? Because it's been crickets on this until what was it last week? The Washington Post comes out and says that the White House says they have absolutely no plan to do anything to
None.
protect access to IVF, right? So this
None.
wasn't just political theater. Honestly, it gave people hope. To me, this was a calculated preying upon people's hopes and dreams, right? It gave people hope. And when that hope died, it hurt, right? It
Uh,
hurt. And if you voted red because of that promise, you deserve to know why it's not happening. Because there was probably 6 months of time, 8 months of time between all the shenanigans of last fall during the election, and then now the Washington Post coming out and saying the White House has no plan. There is a lot of time in there that folks who have been sitting around, they've gone to a fertility clinic, they've had all kinds of hope, then they go and they have the financial discussion. And then that hope
mhm.
is lost when they realize there's no chance they can afford it. But
No
ever since
way.
those comments came out, folks, I think a lot of folks sat and went, okay, maybe this is really going to happen for us, right? So if you were one of those people that voted red waiting for this, you deserve to have an answer and you deserve to hold your reps accountable. And if you've ever been promised something by a politician that directly impacted your life, only to watch them then do nothing, we really, like we said earlier, we really want to hear your story because we're here to uplift and amplify those stories so folks can understand that this isn't just conjecture. This isn't just what ifs. This is real people's lives, right?
I actually had a patient I was talking with doing just a med teach, and the price of pharmacy, the medication for IVF is quite expensive. And it was a couple, and the guy, he was like, so expensive. And I was like, yeah. And he goes, but they said pharmacy, we're supposed to get deals on pharmacy now. And I'm like, yeah, there's also an executive order that was supposed to handle this mandate, and that's not happening. And he was like, wait, what? Yeah, their executive order was signed in February. At this point, it was June. Yeah, it's already expired. So I don't know. We don't know what's happening.
Yeah, I mean, from broken promises to broken systems, I mean, let's just go right into it. Let's talk about Medicaid and the big, beautiful bill because it really ties right in.
Yeah. And because apparently the best way to support families is to kick parents and potential parents off Medicaid.
Right. Forget preventive care, reproductive health, prenatal visits, right? Like, let's just cross our fingers and hope for the best. I mean, why not?
Yeah. Yeah. Here's a real picture. Many reproductive age Americans work multiple part time jobs without insurance, right? Some are already parents and some are trying to save for IVF. And all of them are just trying to survive. It's like they can't get insurance because they're working part time. They don't, the employer doesn't want to give them full time because they don't want to pay for full time and they want to pay for benefits. So then they have to take another part time job and make up a full time job out of two part time jobs without insurance.
It's just a
It's
mess.
great.
It's a complete
Yeah.
mess. And the US maternal mortality rate in 2022, it was 22 deaths per 100,000 live births. That's among the worst in high income nations. And astonishingly and completely unacceptable is that for Black women, it's triple that. Triple.
Yeah, that's crazy. Crazy. Like, it's the United States, man. It's not like we're in some third world country. We are first world country.
No, that's have the money, the ability, the power, whatever, to fix
Mhm.
something and you don't, and you choose not to. That is despicable, honestly, especially when it comes to family building. You have the
Absolutely.
power. to fix it. And that's the real sad part, right? Is that this administration does have the power to
Mhm,
push insurance companies to mandate insurance companies to cover IVF, right? To expand
mhm.
coverage for federal employees and things like that. They have the power, but again, they don't fix it. And to me, for the Black maternal mortality rate to be triple that of others is just, like I said, it's just unacceptable. Do not understand how anybody is okay with that. If a man had to travel hours to get to a doctor, nobody would be okay with that. I think it's important to talk about some of the things. So folks will say, well, close to 80% of OBGYNs accept Medicaid. Okay, great. Sounds fine. But what about the 20% of those whose OB doesn't accept Medicaid, which is your insurance, right? Then what? So if you have Medicaid, you're already struggling. And now we're going to tell you you can't keep your OB, who you have trusted and who you trust to provide this. You can't keep your OB. And now, again, because of the fact that more than half of rural counties have no obstetrics, now we're going to say, you can't even, your OB won't even take your insurance. So, especially with low reimbursement and workforce shortages, we were already facing a significant supply problem of obstetric services in rural areas, right? And I mean, and that kind of goes in line as well as closely though with fertility care, right? Because it's actually worse, very few insurance plans cover fertility care. Obviously, Medicaid does not cover any fertility benefits at all. However, it does cover a lot of prenatal testing and a lot of the IVF workup testing, but we're taking that away.
Well, I've seen people do come in and but the problem with that is when they come into the fertility clinic and they have that, and yes, they can get their blood work, but from my experience, and tell me if you experience this as well, was when those people wanted to do like their workup, blood work, we would tell them what we needed, and they would have to go to their primary
That's right.
care physician, get them to actually order the
That's right.
blood work, and then once we get all the
Yep.
results back, then send it
Yeah,
back to
because the
us.
moment the insurance saw an infertility code or XYZ IVF center, or XYZ fertility center, you're exactly right. So folks would, let's make it even harder on them, right? So you have some coverage for some blood work panels and things like that, but they won't even let us order it. So now we're going to make it even harder on you. We're going to give you this order. You're going to have to go back to another doctor, ask them to rewrite it, go out, have the testing, get the results to us. I mean, what a mess, right? That
It
makes no
Yeah,
sense, and all it does is further disenfranchise folks who are already struggling. Like,
absolutely. Yeah. Oh, and it was always at some point, the primary care, they order the wrong test, even though you write down what you exactly
yeah,
wanted to,
yeah.
but you still had got the wrong test back, and then you got, like, a lipid panel, and you're like, "Well, I didn't want that, but now they have high cholesterol, so we
Now
gotta
I gotta
cross
do
that
something
thing out."
about it, or they order the Hep B antigen instead of the antibody. Yeah,
Oh,
no,
yeah. Oh my god. How many times
no,
did
but
that happen?
we just make it harder, right? Like, we
Yeah.
just, as if it's not hard enough, we make it harder.
Yeah. So, I know we kind of went on a little fertility thing, which we do because we are fertility nurses. But I also kind of just want to bring up that defunding Planned Parenthood doesn't save money. Federal dollars do not fund abortion. And let me say that louder for the people at the back. Federal dollars do not fund abortion. They fund screenings, contraception. Oh, thank you. The peanut gallery has spoken.
They are
They
spoken.
fund STD testing, actual life-saving care.
Yep. And here's the kicker, AnnMarie. In states with abortion bans, OBGYNs are leaving. They're leaving. Who's going to care for the pregnant people there? As the big beautiful bill was moving through the Congress, Senator Ed Markey from Massachusetts actually went to work to run the numbers to see what the eventual outcomes would look like from the proposed cuts, right? And so here's what his office found. They found that rural hospitals are already struggling. Okay. 2023, there were 50 fewer rural hospitals than there were in 2017. Okay. And a lack of healthcare access in rural America is already, like, prior to this bill passing, we were already seeing healthcare access in rural America contributing to worse healthcare outcomes, right? So Now, faced with the additional cuts to their revenue because of this bill, many rural hospitals are going to be forced to stop providing certain services. Remember, we already said only 78% of rural hospitals have obstetric services or what have you, right? So now we're going to have additional cuts. And hospitals that do provide services will close, including obstetric health, including mental health, including emergency room care, right? And they're going to need to convert clinics or standalone emergency centers, or they're going to need to close altogether. And rural hospitals are often the largest employers in rural communities, right? So Senator Markey's office found that when a rural hospital closes or scales back their services, communities are not only forced to grapple with losing their access to health care, right? But on top of it, job loss, right? Further financial insecurity. It's appalling. Again, when you have the power and you have the money to do something about this and you actually do the exact opposite thing, it's just astonishing.
It's mind blowing. I mean, stop to think about it. I mean, it's mind blowing. I'm just kind of like, okay, so we're gonna take away these hospitals. We're gonna shut down the biggest employer in town. So where are these people supposed to go? People want to stay close to their home, their roots, right? They want to stay close to their family. But what other choices do they have?
Yeah.
None. You know?
No, they don't. And
Yeah.
to me, to kick people while they're down, right? Like these folks are already struggling. This is the state of affairs before these cuts go into effect. And we may have it to, we may mention it later, but it's really uh, sinister, I guess I'll say that they plotted for a lot of these cuts to not even hit until the midterms are set in stone, right? Because they know how bad this is. They know it. I mean, look at certain representatives like an Arizona rep who supposedly fell asleep, right? He fell asleep and didn't make the vote that passed by one vote. Yeah, right. Right. I mean, so to kick people while they're down, it's
Yeah. Yeah. No, I mean, reading that it's like over 300 rural hospitals in the US that are going to be disproportionate risk of closure. And that includes 33 hospitals in Louisiana, 35 hospitals in Kentucky, and 21 hospitals in Oklahoma. And that's a lot of red state hospitals. I'm just saying. Not
no, it
saying, but just saying.
No, absolutely. I mean, previously Senator Markey, along with a couple of other Dem leaders, um, released some additional data from the Shep Center for Health Services Research at UNC Chapel Hill. And they concluded that these Republican healthcare cuts in this House Republican passed bill could place over 300 hospitals at
Crazy.
risk. And so for 33 of those, to be in Louisiana, 35 to be in Kentucky, 21 in Oklahoma, places where they're already struggling, right? It's
Oh, yeah.
insane. It's totally insane.
The 33 hospitals in Louisiana. Louisiana, it's not like a huge state. Doesn't have a huge population there, so it's actually pretty significant.
No,
You
I
know,
I gave birth in Louisiana. My oldest daughter was born there, and OB care is not easy to find. It really isn't. And I lived in
yeah,
one of the major cities there, but often heard from folks in the surrounding places that they were having to come all that way to just to get obstetric care. And in my mind, as a former labor and delivery nurse, my first thought is, what are we doing if we tell somebody, yeah, the closest hospital for you to deliver your baby at is at 2 hours away? What? Like, you might as well just if that patient is a multip or she's had a baby before, she's multiparous, she's done this before. Your risk of precipitous labor or super fast labor is it increases with each subsequent delivery. So now we're
mhm.
gonna just like have people have babies on the side of the road on their way to their hospital. I mean, it's just insane.
I-10, people gonna have baby on the I-10.
Yeah, great. What could go wrong?
Nothing. I'm pretty sure that those, highway patrolmen, they know what they're doing, right?
We can hope.
So go
One can hope.
since we're talking about Louisiana, um, I remember, our mutual advocacy doctor,
For
Nicole
Ulrich.
Ulrich.
Yep.
I remember her saying there were only 10 REIs in the whole state.
10 fertility
10.
doctors.
And 2 of them were about to retire, so that leaves 8.
Yep.
8 REIs to help people with their infertility in
Well,
the entire
AnnMarie,
state.
we're not even graduating enough replacement. So REI stands for reproductive endocrinology and infertility. That's a fancy name for a fertility doctor.
Fertility doctor.
Currently, there are more REIs leaving the field, retiring, passing away, whatever, than there are coming in.
That's pretty grim.
It is. And we only have, we already have this shortage, right? Um, and so when you have a supply and demand problem, you need to be finding a way to increase that supply. And so we're only graduating enough REI fellows to move into those roles to cover about 90%. So each year we're losing ground on our capacity. And yet every year, like I know since I started in fertility, when we started, you and I started in a similar time, we always said 1 in 8, 1 in 8,
Mhm.
1 in 8, one in
Yep,
eight. And
yep.
as of this May, I think we're at 1 in 6. And that does not include, by the way, folks who need IVF for other reasons, such as LGBTQ families.
Mhm.
There's a lot of different reasons, right? That doesn't even include them, single parents by choice. We're just talking 1 in 6 people has the diagnosis of infertility. Terrifying that we went from 1 in 8 to 1 in 6 in 10 years. And now we're
Yeah.
going to strip care from the places that need it the most.
Yep. Well, if our dear listeners, live in a rural area, we wanna hear from you. Like, you're the ones that are living in those areas that are being affected, so we wanna hear from you. What's access to OB care like where you live? Send us a DM, an email, whatever. We'd love to hear from you just to see what your experience has been out
Yeah,
out there.
absolutely. Yeah, absolutely.
But going back to, the US maternal mortality crisis, it really isn't new. I mean, it's been around.
It's not. I mean, in the 1920s, I mean, the era of from which you are dressed, there was something called the Shepherd-Towner Act, and that actually funded thousands of maternal health centers, right? Even in rural America. But political backlash shut it down.
Hmm, that's weird.
Yeah. So rural
Sorry, I
America,
just made
right?
rolling
We're
eyes
funding
emoji.
maternal health centers. Yep. Yeah. Crazy.
Yeah, I mean, I think by 2016 was it, almost half of the US counties had no OBGYNs and over half had no nurse midwives,
That's
I think.
insane. You
Yeah.
say you want more babies, you want more families.
Mhm.
I mean, and racism has unfortunately kept those disparities alive, right? So today,
Yeah.
Black and Native American women, as we mentioned before, they still die at 3 times the rate of white women from pregnancy related causes. That is
Yeah, and
deplorable and it's unacceptable.
absolutely, and it's not just, like, while they're pregnant, it's postpartum a lot of times too, because they don't go back and okay, think about it, your OB lives 2 hours away. Oh, you're gonna go back in 6 weeks? Like, how many people are gonna be able to travel 2 hours with a newborn to do their 6-week,
Can you even afford the gas to get there and back?
yeah, like, it's crazy.
It,
It is crazy. I
yep,
mean, it's not an accident, it's a result of policy choices,
it is.
for sure. Yeah.
It is. And tell us again, we would love to hear if you've experienced any gaps in postpartum care. We'd love to hear about it. You know, I'd love to hear if anybody had trouble getting that access to postpartum care because we have seen, you and I have seen this and we've heard of, you know, postpartum is still a very tricky time, right? A lot could go wrong. You can have postpartum preeclampsia. And
Yeah.
there's a lot, you have postpartum heart failure, and women are so often dismissed, right? Their concerns, especially if it has to do with pain. I can tell you as somebody who has been a reluctant consumer of healthcare since I was pretty young, and with a rare illness that is not easily understood. so many times you just get gaslit instead. You're like, "Yeah, it's not that. It's in your head." Da, 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 da," right? So we're already good at doing that. We're already good at gaslighting women
Yeah.
and making them feel like their concerns are not valid, right? And so
Mhm.
now we see if almost half of those counties there's no OBGYNs, folks are, as you said, driving. We're losing. We really don't even know the extent to which we are losing women in postpartum because I think many times it's, as you said, their OB isn't even involved when they're very sick, right? So, but here's what people need to understand, okay, is that all of this, all of the reproductive health care hubbub, that we've been embroiled in really since the overturning of Roe v. Wade, people do need to understand that this is about so much more than just abortion. So much
Absolutely.
more.
So much more. I mean, just basic obstetrical care, contraception, birth control, all different types of birth control, cancer screening, postpartum follow-ups. These were important and these are what people need and to basically say, "Oh, hey, we're going to defund this place because they do abortion." Again, I go back to the beginning of what we were saying. It doesn't fund abortion. It funds basic care. And so, regardless of what your politics are or what you feel about it, these women need care. And it's really weird. I think of this really story of when I was younger. My aunt was watching a show, I forget the name of it, but it was one of those 80s shows about women and stuff, and there were Sisters. It was called Sisters. Oh my gosh, was that the 80s or 90s? Anyway, the show was called Sisters, and I remember there was an episode, and they were protesting outside of a clinic, and one of the sisters was just trying to go in and get a pap smear, and she was fighting with the protesters, going, "I'm just trying to get a pap smear," and that's what I think about when I think about people who say defund Planned Parenthood. I'm like, guys, it's so much more than that.
Well, yeah, I mean, there's so much rhetoric that has
Mhm,
taken hold that I think folks have just shut off their listening ears, right? Like they
mhm.
just they're not
Yeah,
listening anymore, right? It's called
yeah,
Planned Parenthood, okay?
yes,
Planned Parenthood, which is
yeah,
why contraception or birth control,
mhm,
cancer screenings, STD testing,
mhm,
pap smears, that's why all of those things are critical because we don't want women going and getting pregnant and then finding out they have cervical cancer in the middle of it all. We don't, I mean, if we want to have healthy outcomes from pregnancies and births, we need to have healthy women going into it, right? But
and
the
healthy
good,
men too.
yeah, absolutely. I mean, you are absolutely right. And I mean, at the end of the day, abortion bans have pushed OBGYNs out of entire states. And I think that that's probably why Dr. Ulrich had the experience that she had in Louisiana because it's very difficult to practice any type of reproductive health care there, whether it be IVF or whether it be other reproductive health services. In Texas, AnnMarie, can you believe this? 76% of Texas OBGYNs say they can't even practice evidence based medicine with these bans.
That's
So
crazy.
folks are using their personal beliefs to impose these bans that are actually just hurting us all at the end of the day, right? Because I know for us as clinicians, evidence-based care is everything, right? Because beyond that, you're just doing things because you think you should, but instead we want to follow the data, we want to follow the numbers, we want to understand what's happening in postpartum care so that we can be better. But if 76% of OBGYNs are saying they can't practice evidence-based medicine, that's scary.
That's
That's really
insanity.
scary.
Yeah, that reminds me of something I heard. It was something about like 2 million women already lack prenatal care access. So, like, if we are going to lose more providers, how is this gonna work? How it's crazy.
Yeah, I
I
don't
can't.
think anyone's really even thought it out. I mean, because it isn't really pro or anti-abortion. It really isn't. It's honestly whether or not you can get care when you need it. That's it. And I
Mhm.
think that in the last 10 years or so, we've really convinced people that they have to choose, they have to be this or that, right?
Mm.
And so rarely is it that cut and dried, right? There's usually some level of nuance, some level of, you know,
There's there's 50 shades of gray.
there are 50 shades of gray. You are right. And so this is not pro or anti abortion. This is just pro people, pro human being. And
Yeah.
I know, and we know from data that abortion bans don't stop abortion. They just stop safe abortion. And abortion rates are actually rising in red states because
Yeah.
women are terrified of not having the bodily autonomy to make that choice for themselves. So we're looking at, essentially forced birth scenarios where, we don't have, we're not given a choice anymore. And as you said, when over 2 million women, as of before this bill ever took effect, 2 million women already lack prenatal care. So,
Mhm.
and we know that prenatal care is directly tied to neonatal outcomes. So, babies who are born to moms who had no prenatal care suffer worse outcomes than babies who are born to moms that had prenatal care. This is
Mhm.
not complicated. It's really not.
No.
And again, when the money is there and the power is there to do the right thing, and instead we're going to strip healthcare, the Congressional Budget Office estimates that this bill is going to kick 17 million people off their health care. And that is just folks with Medicaid. So,
Mhm.
what folks are not hearing is that because of another provision of the bill that rolled back some protections that were in there from the Affordable Care Act, now yours and mine, our insurance premiums are slated to go up by 40% in January because of the rollback of that provision. And that's really scary because you hear, well, first you hear lies. You hear, oh, that's not, we're not going to cut your Medicaid. Okay, I'm done with that. Go read the bill. The bill is very
Yeah.
clear. Okay. And we have to all embrace this idea that when they promise something, we need to not believe them because there have been so many broken promises. So many
Absolutely.
said one thing, did another, right? And I want folks to start thinking for themselves, right? Don't follow
Mhm.
what, if you're a Republican, don't follow what the Republican leadership tells you to believe. Go figure it out for yourself. The same with the Democrats. Let's get, out of this
Totally.
partisan gutter and
Yeah,
start
let's
just
meet in the
talking
middle.
about things. Yeah, and start to yeah, exactly, and start talking about things again, this isn't pro or anti-abortion, this has come down to, can you get the care when you need it?
Yeah. And well, I mean, I have a hard enough time getting into my OBGYN for an annual. Like I usually have to make my appointment months in advance. And if I was on Medicaid, I know either I wouldn't be able to see her, I would have to go somewhere else, or, there are very few people that are going to be able to get in. They don't, a lot of them just don't take it, right? They don't take Medicaid anymore. And another thing that's really getting to me is well, we're just kicking the people who are doing Medicare fraud, and that's who we're kicking off. It's those people. Okay. So what does that mean? It's the dude in the basement of his mom playing video games? You keep saying that, but
So,
that's
my
not.
question, my nephew, he is going to turn 3 in January, and the last time I checked, I think you have to be 15 to get a job? 15.
Yeah, 50, yeah.
Yeah, so my almost 3-year-old nephew, who was born at 24 weeks, 4 days, he is blind, he is tube fed, he is oxygen dependent, he has nursing care 10 hours a day, 7 days a week, and he will get cut. He is not waste, he is not fraud, and he is not abuse. And that's where I really want to encourage our listeners to, if you disagree with everything that we have said in this episode, I want to ask this of you. Would you want your sister, your daughter, your niece, your whoever to be in that position of seeing that all these services that he gets have helped him defy the odds? They said he'd never sit up, he sat up. They said he'd never pull up, he pulled up. But the services that he gets are there as safety nets, right? So he is a great example of the fact that no, we are not just picking off people who can work and whatever. That is a lie. Okay. That is a lie, just like we cared about IVF. That is a lie, just like, oh, we're not actually cutting your Medicaid. Go read the bill. Go read it for yourself, right? Because at the end of the day, we've all been lied to by politicians, right? We've all been sold some bag of goods that then somebody wanted to come back and,
Mm.
rescind, right? So where does it leave us? It leaves us with a choice. We can sit and we can wait for promises that never come. Or we can demand policy that protects reproductive health, right? Because at the end of the day, we have not, we have, we, this current administration has shown us who they are. Okay. They have shown
Mhm.
us that they break promises and they break them and they break them, right? And politicians on both sides of the of the aisle break promises. Okay. But right now, we're talking about the consistent broken promises of our current administration that is going to leave the next 2 years. We are going to see, unless we can effectively lobby, we can take back the House, we are going to see, I think, a real shift in healthcare, what healthcare access looks like in our country. I really do think so.
Yeah,
So
I mean
again, we have that choice. We can wait for those
mhm.
promises that never come, or we can just demand policy that protects our health, our reproductive health, and all of our health.
Yeah, and
So what do we
Elizabeth,
do?
that means calling your reps. That means writing
Yeah.
letters, supporting Medicaid expansion and postpartum coverage. And I've written so many letters to my Congress people, and I get the canned responses back, and it just always makes me laugh when I get the canned responses back. But at least I know it's on record that I wrote to them. I said my say, and yes, I'm getting the canned responses like, "Thank you for writing us. We appreciate
No, but
you as our
they keep
constituent."
those offices keep track of all of that though, Anna Marie.
Absolutely.
They
Yeah.
keep track
So that's what I'm saying is keep on going. You don't
yep,
like something? Keep on going.
speak up. Yeah, because that can response, I know like in the past, sometimes I felt like, man, they're not paying attention because I'm getting this canned response. First of all, would you expect our elected officials to sit down and handwrite? Well, that's not realistic. They're not going to be able to do that, right? So
No.
for
Yeah.
one, like a canned response isn't the worst thing in the world if it addresses the thing, right? I know I've written some of my Republican lawmakers and have been very frustrated at the canned response I've received because I remember getting one again whose name shall not be named, but was essentially like, again, don't worry, we're not really cutting Medicaid for anybody except for people who are ripping the system off.
Mhm.
All of that said, the offices do have records of all of those phone calls, of all of those emails, right? And it matters, right? Well, you also need to back organizations that are in this fight for us. So that's organizations like Resolve, the National Infertility Association. They are an amazing group that does just unbelievable work day in and day out to bring awareness to infertility. There's the American Society for Reproductive Medicine, and they're the academic and scientific backbone of reproductive health in our country. So the science, the research is all so much led by ASRM. And then so first we have to back organizations that are in line with some of these things that are also fighting the fight on our behalf. We also have to ask our legislators to support legislation that is going to protect us. And given that maternal mortality is so abysmal for Black women, I would ask anybody listening, write your legislator and ask them to support bills aimed at addressing, excuse me, the maternal mortality crisis in our country, and with a particular focus on racial and ethnic minority groups, and addressing things like social determinants of health. Right, my zip code has a relation to my outcomes, which how sad is that? I mean, and that's always been one of my biggest passion points is like, you know, I grew up in a rural area and I did have a lack of access because of where I grew up. Because of that, there were a lot of things that happened in my own health journey that didn't have to happen, but they did because treatment was delayed for so long. So anyway, at the end of the day, there's a lot of people out there fighting the good fight, and we have to find them. We have to link arms with them. We have to remember that we're not even people who are quote on our side, right? We're not all going to agree on everything. Never. But
Mm-mm.
this is not the time to pick fights. It's the time to join hands.
Yeah. And for the love of public health, do not, do not let politicians treat reproductive health care like,
Like I treat my laundry.
sure, like, you know, let it pile up and ignore it, and it's gonna get smelly, and wonder why everything's a mess. And
Yep,
luckily, I did my laundry this morning.
good job.
Anyway,
Proud of you. No, absolutely. I mean, let's not let politicians treat our healthcare as disposable. So, on that note, we want to thank you so much for joining us for episode 2. We are, as you can tell, having a blast. We're a little ridiculous at times. We hope you love that. But
hmm
stay informed, stay hopeful, stay ready to advocate. And if you enjoyed episode 2, we'd love it if you share with a friend, write us a review, do all the things. But we'll be back for more. Next week, we're going to talk about sex ed as long as
what?
I know. I know. Did I need to bleep that? But as long as something in the news cycle doesn't pop up that's more, so we want folks to know that we are really trying to pay attention to what's going on and bring that information to you. So while we'll always have a plan, we'll probably make plans to change plans. So we appreciate you being
hmm
with us on this journey, and we will see you all in episode 3.